Imagine being able to guide your patient from the very first appointment all the way to their final smile, with precision, predictability, and efficiency at every step. That's the promise of 3DDX. Welcome to the 3DDX Restorative Journey, your complete guide to delivering both temporary and final restorations with confidence. Every restorative journey is unique, and that's why flexibility is key. Some cases simply aren't suitable for immediate loading. In those cases, we provide immediate dentures, relined and delivered right on the day of surgery, so your patient never leaves without a smile. But when conditions allow for immediate loading, we go further, delivering prefabricated GFMR or post-fabricated GFMP or FMP restorations, fully customized to your workflow. Whether conservative or advanced, the process adapts to your patient's needs and to your way of working. The foundation of all restorative success comes down to one principle: accurate data. The better the data, the more precise the outcome. With the right records, we're able to create a virtual wax-up that aligns surgical planning with the restorative objectives, ensuring the final outcome matches your design. This removes guesswork and replaces it with precision. For partially edentulous patients undergoing guided full mouth rehabilitation or photogrammetry, the essential records include PVS impressions or intraoral scans, jaw relation records, sometimes using bite blocks if the patient does not have definitive occlusal stops. A CBCT scan is essential, and digital smile design photographs as well. Optionally, you can take facial scans, and you should provide us with detailed information about the prosthesis and photogrammetry technique used in this case. While for fully edentulous patients, all of those records are required, but we add a few critical steps. These cases call for the dual scan technique. You can use the existing patient's denture, or 3DDX can provide you with either a base plate or a denture, fabricated to ensure precision with your impression. An accurate bite record in centric occlusion is also essential to set the foundation for occlusal stability and aesthetic predictability. By collecting this data upfront, even the most complex full arch cases begin with reliable, validated records. Every project follows a structured sequence at our lab. First, we perform a scan superimposition and create the virtual wax-up. Then we move to restorative-driven treatment planning, where our clinical team works closely with you to finalize every detail of the surgical and restorative plan. This workflow keeps you in control while giving you the confidence of expert support at every step. After planning, we prepare and ship a complete surgical package. Our signature magnetics GFMR package includes flap guide, pin positioning guide, bone reduction guide, and implant surgical guide, all together with a stackable interim pickup PMMA restoration to support immediate function. For added flexibility, we can also provide a clear duplicate of the restoration that helps bridge the temporary to the final stage if you prefer physical impression methods. Whether you proceed with implant placement via a fully guided approach, partially guided, or even freehand, 3DDX will support you for confident and satisfying immediate results. If you opt for the post-fabricated restoration option, you want to make sure you're using some sort of a common registration object to help merge the pre-op situation along with the wax-up to the post-op situation. This includes, but is not limited to, using strategic existing teeth and patient anatomy, arch tracers by Digital Arches, the mod tissue tracker, DES fiduciary marker, or the magnetic stackable surgical guide. Once the implants are in place and the MUAs are correctly inserted, photogrammetry becomes the next piece of the puzzle. Photogrammetry has revolutionized restorative dentistry by giving us an incredibly precise way to capture implant positions and prosthetic relationships. And at 3DDX, our workflows adapt to the system you're using. If you're working with Shining 3D's AOX Scan Elite, the process involves intraoral scans and photogrammetry scans, all done seamlessly utilizing a single device to scan their high accuracy coded scan bodies and then cap scan bodies for the gingival scan. If you're using OptiSplint by Digital Arches, you'll need the verification jig scan and then the gingival scan taken with the MUA scan caps. With MicroMapper, the workflow combines intraoral scans, photogrammetry scans, and gingival records. Regardless of the system, we make sure the process is smooth, consistent, and integrated into your restorative plan.
If you'd rather focus on your patient instead of managing the restorative steps, 3DDX offers chairside assistance for GFMR cases as well as for photogrammetry cases. For a small additional charge, one of our certified dental technicians can be present on the day of surgery to assist with the pickup and finishing of the prefabricated provisional restoration, or to support photogrammetry scans and post-fabricated restoration workflows. Depending on your setup, this may include in-office printing with pre-booked digital designs ready within 1 to 2 hours, or 3DDX can fabricate the provisional restoration and deliver it within 3 business days.
When it comes to the final restoration, there are 2 main workflows, digital and physical. In the digital workflow, you'll scan the provisional restoration and the bite, remove the restoration, and CT scan bodies on MUAs. Then proceed with your preferred method of intraoral scanning or photogrammetry, or a combination of both. Eventually, you would export all STL files directly to 3DDX. This method is fast, efficient, and integrates seamlessly into the digital design and planning. In the physical workflow, we rely on the clear duplicate impression. The process is simple but precise. Remove the provisional restoration, modify the fitting surface of the picked up duplicates, apply tray adhesive, then reseat the duplicate and inject PVS to capture soft tissue. Then record the bite and submit all of this along with your DSD photographs to 3DDX. Both pathways, digital and physical, lead to the same goal, a precise and predictable final prosthesis. Once the healing phase is complete, the restorative process continues with the try-in PMMA. Each try-in is delivered with either tie bases or direct to MUAs based on your preference and the restorative options supporting the implant line used. At this stage, confirming a passive fit is critical. If adjustments are required, section the PMMA, reseat it, and rejoin it intraorally. Once occlusion and aesthetics are refined and approved, send the updated PMMA back to 3DDX. We'll then fabricate the definitive prosthesis, locking in long-term function and aesthetics.
Chairside assistance doesn't stop on surgery day. You can also pre-book our support to help with the transition from provisionals to finals. After the scans are complete and verified by our designers, we can provide you with the final try-in. Our regular final restoration workflow includes 2 try-ins fabricated by 3DDX before sending you the final. On the other hand, we have introduced the digital Zirconia pathway. This option is specifically designed for clinicians who have an in-office 3D printer. We handle the design, then send you the digital try-in file for chairside printing and evaluation. Once the try-in is clinically approved, the final Zirconia prosthesis is fabricated and finished by the 3DDX master ceramists.
So, if you're ready to elevate your foot arch and restorative cases, partner with a team that's trusted by clinicians worldwide. Connect with us today and let 3DDX help you bring predictable smiles to life. For more insights into guided surgery, digital workflows, and restorative excellence, subscribe to our YouTube channel, follow us on social media, and visit our website.